honored and privileged to welcome you to the 8th edition of the Nigeria Implementation Science Alliance Conference. Your presence here today reaffirms our collective commitment to advancing implementation science and exploring innovative pathways towards improving healthcare outcomes in Nigeria.
We are very excited to receive everyone today. I'm really so honored. Ekis is so honored to be the host of this very important conference. I want to welcome our former minister, Professor Adewale, and our colleagues from the US who came for the conference, for the cancer conference, colleagues from PEPFAR. I see Dr. Helena, I see Fumi. I have the pleasure of really bringing this important session, bridging the gap. And we do know that evidence is so vital to policy, but how much has that happened in our countries?
You're going to remember Nigeria, you're going to remember Ghana. These are countries that are in West Africa, and there are a lot of Francophone countries that are in Africa. But there are a lot of implementation, but we haven't really contributed much into the picture. If you go to the shelf of many programs in Nigeria, from one IP to IP, the data they have, if you move to CDC, to USID, to DOD, the data they have, you can actually write 20 publications.
I think one criticism but opportunity that we've heard from PEPFAR is that oftentimes the communities that are actively involved in generating the data may not be carried along when it's published, or you may not see them represented in the names and the abstracts, so they're not going to the IASs or the ACASAs. And so that feedback loop, that communication, that engagement of sharing that information is going to be critical to ensure that that information, that evidence that's generated when we talk about application and knowledge transfer really truly cross-pollinates, especially here in Nigeria.
It's important to hear the successes, and the successes they shared were not, oh, we wrote this many papers, oh, we sent this many people to conferences. The successes you mentioned are lives saved, right? Through addressing postpartum hemorrhage, through identifying babies who were at risk for transmission. So I think that alone, for me, makes it worth trying to find a way.
For you to understand even the research that is out there and apply it to clinical practice, which most of us do every day, you need to be able to understand the data, understand how to interpret data, and also be able to see how your current implementation is different from what has been described in literature.
Of what research is all about. So the researchers that we have here and even the future researchers, that if we are embarking on research, what is actually needed is we should base our researches on things that are actually the problems of the country and those issues that are of interest.
Through evidence that we have generated since 2006, giving visibility and a voice to the population, we have used the first study which was conducted to provide the tools and strategies for the first integrated biobehavioral surveillance survey.
Data science, new methods, whether that is mathematical modeling, network analysis, the genetic analysis, these are all things that are being built and are absolutely transferable. So once again, thinking about the trade-offs, these capacity building skills, it seems like it's worthwhile to invest.
We have the National Health Insurance Authority. So we have strengthened the community-based insurance scheme and also strengthen the other non-formal health insurance schemes. So as a country, in terms of health financing, I think we are much better.
Really speaking from my experience previously working as country director for Resolve to Save Lives, where we worked very closely with the Nigeria Center for Disease Control around preparedness and response, and also working with the Nigeria Federal Ministry of Health on hypertension and general control of NCDs.
And in training a lot of healthcare workers, both lay healthcare workers and facility-based or professional healthcare workers. That's what we could mobilize and leverage for service delivery that was related to Ebola, although Ebola was on a, thankfully, more limited spread in Nigeria versus COVID-19.
To identify determinants and strategies for cervical cancer control. In that process, engage stakeholders across different parts of Nigeria.